Hi, everyone. Welcome to part 4 of our 7-part series on organizational and occupational psychiatry topics for residents. If you haven't met me in prior videos, I'm Parker Schwab. I'm currently a PGY4 psychiatry resident at the time of the making of these videos. I do want to thank my assistant author, Sam Gardner, and then my advisor, David Morrison, in helping create this curriculum and these lecture series. So we'll just go ahead and get started. Before we begin, I do want to go over some disclosures. So we don't have any current conflicts of interest or financial disclosures in terms of this curriculum. Also, we will be using the term org psych or organizational psychiatry throughout this lecture series. But please note that this encompasses both topics from psychiatry as well as psychology. These fields often overlap but are distinct entities. So just please be wary of that as we go through this lecture series. So to go over what we've gone through before, so in section 1, we covered what organizational and occupational psychiatry is, just briefly, including a history of the field. In section 2, we went over why organizational psychiatry matters to us as physicians, as well as to our clients and patients. And then in section 3, we went over the U.S. Surgeon General's framework for the components of a healthy workplace. And so this hopefully has set us all up to begin thinking about how we might begin conversations of work with our patients and how to navigate this. And so in section 4, we'll be covering the topic of how to take a work history with our patient and how that might be relevant in our psychiatric discussions with the patient and then also potentially even the diagnosis. So in general, what is a work history? So it's when we start talking to our patients about their work life, including their developmental history and their history of their career paths. This is really important to have this discussion with your patients because it helps provide information on patient function. In addition, it helps you identify career goals and establish rapport with your patients. It also helps physicians realistically assess patient expectations, their skills and qualifications, which can be helpful both diagnostically and from a treatment perspective. And then also it helps assist with understanding how patients may adapt their perceptions and expectations of their career and their life going forward. So we as psychiatrists are uniquely suited for this role, as we often provide a source of reality testing and integration of the self through various psychotherapeutic modalities and tools. We are adept in listening to our patients, especially when it comes to occupational hopes, and then also integrating these hopes with current realities, which is a large part of what a work history helps us do. And then also we're able to help our patients or clients explore possibilities within their own career and what that might mean going forward. So this is just a general framework of how I think about the work history. I've broken it out into several sections just for ease, and hopefully this makes it a little bit easier to think about. But I first think about developmental history when it comes to the patient's career and work life. So what did their parents do for a job when they were growing up, and what were their parents' attitudes towards work? What were their childhood chores, and what was their work ethic towards their chores growing up? Was it a strict militant household, or was it more kind of free form, do your own thing, be more of an entrepreneur kind of environment? Think about what their goals were growing up. Did they want to be an astronaut, or was it more realistic? And not saying that being an astronaut is not realistic, but for some people, that might be hard to achieve. Did they meet these expectations growing up, and what does that mean to them psychologically, and how is that impacting them now? And then also, how does that relate to their first job for pay? What was the job, and what were their reactions like working, and how did they respond, and how does it relate to what their job is currently? You then want to go into a pretty robust description of what their current job is. So you want to ask questions like, where or how did they get their job, and what is their current position and role? What duties do they have, and what daily tasks are they assigned? are their work hours really long, or are they relatively short? Do they have any effects on sleep? This is critically important when we think about patients with things like bipolar disorder. And then also we want to go into where does their work come from? Is it something that's from the top down, where a manager will assign them certain roles? Are they able to be more entrepreneurial in their career and kind of find their own projects to work on? What does that mean to them? And how do they relate to that work? And then also, where does their work product go to? Is it something where they just do Excel work all day and then that goes into a database and it isn't really ever acknowledged by other people? Or is it something where they do grand presentations and have large audiences? How do they relate to that, and does that fit their psychological needs at work? You also want to think about how feedback is given. Is it done in person? Do they feel like they have a good relationship with the person giving feedback? How do they respond to the criticism? Do they feel overly criticized at work, or do they feel like they're able to adapt to any sort of feedback that they're given? And then also, do they find their work meaningful? And also, do they feel like it gives them a sense of purpose? As you know, a psychiatrist, that is really important in a person's psychological life, and can have a lot of implications and or impacts on how they view themselves and their sense of self-esteem and efficacy. You then want to go into their relationships at work. So who works with them? Do they work in teams? Do they like their boss? What is their boss like? And then also, who are their friends at work, if they have any? So really delving into the interpersonal relationships and dynamics at work, and see how they respond to any sources of interpersonal conflict, which may be important, maybe suggesting an underlying personality disorder or some other psychiatric diagnosis. You then want to go into incentive structures at work. How are they promoted? Can they be promoted? Is their pay going to be docked if they're not doing a good job, which may be more of a competitive work environment, which could present a lot of stress? And then also, do they have abilities to get away from work while they're at work? So being able to take short breaks if things are stressful, are they able to find ways to cope with work while they're in a stressful environment? And how has that been going so far, and how has that impacted them? You then want to delve into their prior work experiences. So what types of work have they done in the past? What was their motivation for pursuing those jobs? What were their expectations of that job, including expectations that were put on them? And then also, did they live up to those expectations, and how do they relate to that? And how does it affect them now psychologically? And how has it affected their sense of self-efficacy and preservation? In addition, you want to talk about transitions in their career in the past. So did they leave a job in the past because they were feeling like they just didn't have enough meaning at work? Or did they get let go because they were having poor performance reviews? And what did that mean to them, and how did they go forward from that? How were they supported during those times as well? Did they have a strong support network? Did they have people they could fall back on if they were having a hard time? Or did they mostly kind of grin and bear it and just try to get through on their own, and be a little bit more independent with that? And that kind of might suggest maybe what their attachment style is, and kind of how they navigate those areas of conflict in their life. And then also, you want to talk about qualifications. What types of skills and training have they had? What other qualifications or certifications do they have? And that can help you figure out what might be their areas or their opportunities in the career path going forward. And then also, if the patient's having a hard time with employment, or if they're unemployed, that might help you navigate what might be realistic options for those patients to pursue in terms of their career going forward. And finally, you want to think about areas of growth. So if they've had prior negative performance reviews, what were the suggestions for growth or recommendations of growth? And then what areas have they struggled in the past? It can kind of help you understand the dynamics of conflict with them, and then also what might be areas of of growth in the future, and then areas that you might be able to target for any treatment interventions. So this is a slide that kind of goes along a different framework using the U.S. Surgeon General components of a healthy workplace. So it's just a little bit of an extension of what we've been working on so far, but choose what works best for you. I'm not telling you there's any perfect way of doing a work history, but these are just ways to start framing how you think about these conversations and how you navigate them with your patients or clients. So if you think about the U.S. Surgeon General's framework, there are 5 pillars. So the first is that purple section of mattering at work. So when you are thinking about asking these types of questions to your patients, you want to dig into dignity and meaning. So asking questions about if they feel respected at work and valued, and do they find their work meaningful. So for the second pillar of opportunities for growth, you really want to dig into if they feel like they have a lot of avenues for learning. How do they go about finding those? If they're available, is that supported at work? Is there clear paths for advancement at work? Or do they feel like they're generally just stuck, which can also have psychological ramifications. For protection from harm, that's digging into senses of safety and security at work. So do they feel physically, mentally, and financially safe at work? Have they been experiencing any discrimination, bullying, or harassment, which is a critical question to ask, as you can help try to navigate any of those conflicts if they are occurring. And then do they have safety supports available at work, and what are they, and how do they use those resources if they are available? For connection and community, which is the blue section, you really want to ask if they have a strong support system at work, what it's like, who they can go to if they're having a hard time. Do they have a mentor? If they don't have a mentor, what are the options? Which also kind of plays into the opportunities for growth. And then I think most importantly, or maybe not most importantly, but an important thing to also ask is if they feel accepted as part of the team, because we know that isolation and loneliness can lead to a lot of depressive disorders. So if they don't feel like they have a strong support network, that might be a strong source of feelings of isolation and loneliness. And finally, but not least, work-life harmony. So thinking about autonomy and flexibility. Does a patient or client feel like they have control over when and where and how they do their work? Do they have access to paid leave if they need it? And then also, are they able to establish firm boundaries between work and home? And if they are able to, have those ever been infringed upon? Does their boss often ask them to do work outside of normal hours? And if so, how do they navigate those conversations? And you may be able to help them navigate those conversations as well. So that does conclude this section. It was a little shorter. I hope it was helpful to think about maybe how to start navigating those discussions with your patients or clients on the work history and how it might be impacting them, as it will, I think, give you a lot of valuable information into what might be going on with them psychologically, and may help with diagnosis as well, and will allow you to more fine-tune your treatment plan for the patient or client. So with that, I will conclude this section and we'll move to the next part 5. Thanks.